1 p.m. I'll call the meeting to order. This is the conflict assessment, chapter 164 meeting between LSHA Hospital Authority and the City of Lake City. And we want to have everybody introduce themselves. We'll start with Mr. Onsparger.
Sid Onsbacher, outside counsel for the City of Lake City.
Don Rosenthal, City Manager.
Clay Martin, City Attorney, City of Lake City.
Noah Walker, Mayor of Lake City.
Todd Kennan, attorney for LSHA Hospital Authority.
Dale Williams, Executive Director, Lakeshore Hospital Authority.
Don Kennedy, member of Lakeshore Hospital.
Terrell Arline, outside counsel, assisting the authority.
Next item is adoption of the agenda. Everyone should have it. We have any deletions, changes requested. Entertain then a motion to adopt the agenda. We need a motion. It's kind of tell you what I was told. All right, so let the record reflect no one requested any additions or deletions to the agenda, so we'll move forward as planned. The purpose of the meeting, as stated in the notice, is to discuss issues related to the city's contention that the Lakeshore Hospital has lost its legal non-conforming use status under the city's land development regulations, as set forth in the city manager's letter to the authority dated October 24th, 2024. Additional issues to resolve include the transfer of other authority properties and assets to third parties. And at this time, I'll turn it over to the mayor.
Thank you. We're going to have public comment on this. We have two folks that want to speak to this issue. So what I would ask is please maintain comments to 3 minutes. And if you're going to find that you're repeating somebody else's comments, just speak affirmatively to that. It's your right to speak fully to it, and I appreciate that. So we'll begin now, and I'll call Mr. Tim Atkinson.
I didn't lose any minutes.
No, you didn't.
Okay, thank
We
you.
haven't started yet.
All right. I am Tim Atkinson, a resident of Lake City for 45 years, former director of North Florida Mental Health Center, in behavioral health care for nearly 20 years, during which time we built all of the facilities on Michigan Avenue, now operated by Meridian for the past 20 plus years, including Gateway Crisis Stabilization Unit and the Williams Manor Residential Treatment Facility. Eventually, we also built and operated the same facilities in Putnam County when our service area expanded. After 20 years in the trenches, I did learn a thing or two about CSUs, SRTs, RTFs, and the like. Perhaps as important as any lesson learned was the real estate principle of location, location, location. By conveying property to Meridian, the hospital authority is proposing to transform our old municipal hospital into a regional mental health treatment facility, including CSUs for children and adults. CSUs and hospitals are totally different animals with different licensing standards under ACA. CSUs are licensed under Chapter 65E12 of the Florida Administrative Code. Stringent security measures are included, including secure fences. Hospitals are licensed under Chapter 59A-3. Think of CSUs as the MASH units of community psychiatry. Emergency treatment for the sickest of the sick, not for the walking wounded. Sometimes it ain't pretty. Forget visiting hours on the wards, inpatient rooms. Forget coffee shops, cafeterias, and ladies if they're still around. In addition to CSUs, the Hospital Authority Meridian contract includes, quote, inpatient crisis emergency program and, quote, inpatient psychiatric beds. There are no licensure provisions for programs with these titles. We don't know exactly what facilities those will be. We might guess, but guessing just not good enough. So the basic question, again, reverts back to location, location, location. 2 blocks from the downtown center, a couple of 100 yards from Wilson Park, Darby Pavilion and Amphitheater, the Rotary Playground, and adjacent to residential neighborhoods. So, I believe the fundamental question to be, is a regional mental health center with CSUs the best and highest use of this unique site for the citizens of the city and county? I conclude with a statement from an article entitled "The Status of Non-Conforming Use in Florida" from Florida Bar Journal, March 2005. Quote, ultimately, local governments are charged with the interpretation and enforcement of their codes, and their interpretation will not be overruled unless it is clearly erroneous.
Thank you, Mr. Atkinson. All right. We also have Ms. Debbie Griffin. Please make sure to speak into the microphone.
Name is Debbie Griffin. I am here as a resident of the downtown area of Lake City as well as a business owner. I have a practice location on 183 Northwest Veteran Street, which is directly behind the police department, as well as my residence, which is 359 East Duval, right across the lake from the current Lakeshore Hospital building. In reviewing documents from the Lakeshore Hospital Authority minutes and a special meeting that was done back in February of 23, there's a map, a proposal that was done by Meridian. Biggest concern for me is, and I'll try not to reiterate anything that Mr. Atkinson said, is the crisis setting unit where fencing is required. So in the regulations for that, each facility has to be fenced, has to have a fenced outside recreational area with a minimum fence height of no less than 6 feet. So I haven't heard any mention, I've only heard about what's happening potentially on each floor of the hospital, not what is going to be happening outside, which I can see across the lake from my house. The kids that play in the park will see. The people who walk around and exercise around the lake downtown will see. In these areas, the folks that are being treated, which they need to have a place to be treated, I have no qualm with that whatsoever. They can't be locked up inside all the time. So they're gonna have to be out where the public is mixing and mingling to some degree. Now, the second issue, the forensic beds. They have estimated that they would have 30 forensic beds. What is a forensic bed? Services for people with mental illness in the criminal justice system who are at risk of offending or pose a risk to themselves or others, and those referred from the general mental health system for specialized treatment, specialized advice and treatment. The average, based on Meridian's information, the average stay for the forensic beds is 6 months. 6 months in the downtown area, having to have access to outside, which means the people who enjoy the downtown area and the walks around the park and the exercise around the park, how's that gonna work? I have grave concerns about that, because if it's not gonna be safe, if people are not gonna feel safe, then I feel strongly that the downtown area is not the place for this. Besides, Meridian has a big, huge piece of property right across the street from where they already are. So thank you for listening.
Thank you, Ms. Griffin. We have one more registered speaker, and that's Mr. Lilker.
Thank you, Your Honor. Stu Walker. I live 6.5 miles from the thriving metropolis of Fort White. My understanding today is that we're here to discuss a property issue, not whether you should have a hospital downtown, not whether you should have the hospital authority should go into the food truck business like it tried to do years ago. Then Attorney Koval made thousands of dollars talking about food trucks. We're not here for that. We're here to talk about property. And what Mr. Rosenthal claimed some time ago was the city's claim on this property, from what I understand. That's what we're here for. I'm here for to talk about other things. Lori Chance, who has been on the board since forever, I've been covering the hospital authority, as you well know, since about 2006, claimed through various meetings after Shands and Lakeshore packed up their bags and left about $4 million of taxpayer money ago, that the property should go to the people who paid for it. That's the taxpayers of Columbia County. And those taxpayers live in Lake City, they live in Columbia City, they live in Fort White, they live south of Fort White, close to High Springs, they live all over the county. Thousands of taxpayers paid the money for that property. Ms. Chancey's idea is that the people that paid for it should get the property. That's not the college, sure, it's not for profit, you can give it to them. That's not a hot dog stand. That's not anybody else. That's not Meridian. And if Meridian shouldn't have that, it's not for the reasons that people are mentioning here. It's that Meridian just does a shitty job. And everybody will tell you that. So, that's not why we're here. We're here to talk about this property and what Don Rosenthal and Lake City's claim on this property is. Everybody knew that the hospital authority has this thing, that this is a continuing thing for the hospital. That's bull crap. It was mentioned years ago, when Meridian first started talking about it, that they did not meet the ACA requirements to continue as a hospital. So it's about time everybody started facing the facts. It's not about zoning. That hospital became a hospital 6 months, as soon as Dale Williams couldn't find anybody to occupy it. And I think they had a year or 6 months for those ACA regulations to continue, and they didn't. The fact that the hospital authority is now claiming, and I know my time is up, so you don't have to interrupt me.
Bring it in.
I'll bring it in, but you do that to everybody. People understand how the clock works, Your Honor. In every other place but here.
Thank you, Mr. Wilson.
So, to end this, I think you need to think about exactly who gave the money and what the purpose of this meeting is about, which is only about Lake City's claim on this property. Thank you very much, Your Honor.
Thank you, Mr. Welker. All right, we'll close public comment. I have nobody else registered. So back to you, Mr. Kennedy.
All right, next agenda item is discussion of issues pertaining to the conflict. And first up is Lakeshore Hospital Authority, and Mr. Arline will present for the authority.
Good afternoon. My name is Terrell Arline. I am a special land use counsel to Lakeshore Hospital Authority. I was brought in to assist with the zoning dispute raised by the city of Lake City that Lakeshore Hospital had lost its legal non-conforming status. So I want to, under the 164 process, we're supposed to address the issues pertaining to the conflict, and that's what I'm going to hopefully review. So, sort of the history of how we got here. In October of 2024, City Manager Rosenthal wrote a letter to Dale Williams, Executive Director of the Lakeshore Hospital, claiming that the Lakeshore Hospital had lost its legal non-conforming status under the city zoning codes. And what that means is that it can't continue to operate as a hospital because it lost its grandfathered status, is what legal non-conforming use really means. So the position of the city was you had to go through all the new zoning codes and get special permits and all of that in order to continue to operate it as a hospital for that reason. So that had the effect of confusing the legal zoning on the hospital property and may have interfered with the ability of the authority to continue its negotiations to surplus the property to Meridian. I'm not putting words in anybody's mouth, but that's kind of what might have occurred when that happened. And that was, a significant thing that I deal with as a land use lawyer, especially when people are buying real estate and doing transactions that involve, property. So on December 6th, on behalf of the authority, I wrote a letter to Mr. Rosenthal outlining my legal opinion as a land use attorney that the city manager was incorrect, and that under the city zoning code, the authority had not lost its non-conforming status, and it could continue to operate as a hospital. And I laid that out in a letter, but one of the bases of that, my opinion, that the authority was still grandfathered and had not lost its, the hospital had not lost its non-conforming status, is because the authority had been spending about $50,000 a month to maintain the hospital, to keep it secure, and in the interim was trying to surplus the hospital to a third party. So that is basically a way of arguing that the authority had not abandoned the use of the property. They were working to try to get it transferred to another entity that would operate it as a hospital. Under the case law of non-conforming status, the law is you have to intend to abandon your property. It's non-conforming status. You have to essentially walk away from it. And that's clearly not happening here. The authority's been engaged for a long time to try to find a new operator and to transfer it. So I sent that letter to the city. On January 6th, the city manager withdrew his letter claiming that the hospital property had lost its non-conforming status. But the letter didn't recede from the city's prior position that the authority had lost its legal non-conforming status. So that issue was still kind of out there, even though the city pulled back its letter. So the question to me was, well, what do we do now? If can't, at that time, if the city wasn't going to clarify the zoning issue, the only chance we had was to take it to a circuit court and get the judge to say, Judge, is this property still, has it lost its non-conforming status or not? That's something that circuit court judges do in Florida. And fortunately, and I mean fortunately in a good way, as a condition of filing suit between governmental agencies, and the authority is a governmental agency, just the city is a governmental agency, the authority is a governmental agency, it's a special district created by the state of Florida. Under this statute, Chapter 164 Florida statutes, the Florida law is that these governmental entities must engage in conflict resolution before they file their lawsuits, okay? So that's what this is. This is the Chapter 164 process. The legislature said in that law that you have to try to resolve your dispute out of court. You may need to go into mediation, but you gotta have notice, public hearing, and the whole process is laid out in the law about the conflict resolution process. And so pursuant to that, on January 13th, the authority adopted a formal resolution to initiate conflict resolution with the city on the issue of whether the hospital property had lost its legal non-conforming zoning status under the city's zoning code and comprehensive plan. So this meeting that we're having today is called an initial conflict resolution meeting. It's what the statute says you gotta have. And we are doing that. The statute states that the representatives of the authority in the city, and it doesn't, the initial conflict resolution meeting is not between the full board of the authority and the city commission. It can be representatives, and those representatives are here today representing the authority and the city. What the statute says is that at this meeting, they shall discuss the issues pertaining to the conflict and an assessment of the conflict from the perspective of each governmental entity involved. That's what we're here to do today. That's what the legislature's told us we have to do. And at a minimum, that's what the parties have got to do today. They can do more than that. They're not hemmed in by that statement, but they have to at least do that. They certainly can discuss potential resolution of the dispute. They can make recommendations out of this meeting or other meetings. They can schedule other meetings, make recommendations for a conflict resolution that would go then to the city council and to the authority board for approval, and the conflict resolution process would be finalized. So that is one way that the statute provides. It also says that if the parties, if this initial conflict resolution meeting doesn't result in, a proposal to resolve the conflict, then there's a joint meeting between the city and the full city council, commission, and the full board of the authority to do the same thing, to discuss what we're talking about here today. So I'm here to assist the parties with the resolution. I'm not going to present what it should be. I think that's something that the members of the authority and city are entitled to do. So I'm here to assist, and that's all I have. Do you have any questions?
Thank you very much. I'll get started again, see if you have anything to add. The city's overall concern with respect to the future of Lakeshore Hospital Authority's lands and properties is uncertainty created by the transfer of those properties and the potential uses for those properties. All the other proposed uses for all of the buildings except for the main hospital buildings are focused on traditional property uses in the downtown area, aka traditional doctor's offices, healthcare, education, and government administration. The proposed use for the main hospital building for mental health services presents certain compatibility concerns for the downtown area. Aside from the historic use of the hospital's properties, the downtown area's primary uses are retail, restaurants, general commercial, general government, residential, and recreation, both passive and active. The proposed use with Meridian presents certain public safety, financial, and general compatibility concerns as well for the city that must be addressed because they directly impact the citizens and taxpayers of our area. Public safety, mutual aid issues rendered by the city's police and emergency services that require the dedication of limited resources to address the specific and recurring needs created by Meridian. This is substantiated by response from data in our police department, which have been previously presented to the hospital authority and continue to be available upon request. Financial issues. These are associated with the increased public safety burdens that will have to be borne by the city's taxpayers, absence of some other action, and beyond the traditional and historic uses of the lakeshore properties. These additional public safety burdens created by this proposed use will largely be uncompensated, and the city will receive no tax revenue from the property since it's anticipated that Meridian will claim an exemption from ad valorem property taxes. The general compatibility issue. Historically, when contemplating a hospital in the downtown core in the lakeshore facilities, the use of the main facility as a dedicated mental health facility without offering other diversified medical services traditionally offered at that site is a departure from what this community has considered to be a hospital. The potential public safety and financial impacts of the new proposed use are not compatible with traditional and customary land uses for downtown, especially given the public safety and financial impacts. In meeting and talking through how we thought resolution could come to these issues that concern the city, its taxpayers, and its citizens, some actions that could be considered, and there certainly need to be steps towards some of them, but just some of these should be considered. Incorporate additional safeguards into the documents controlling Meridian's proposed uses of the main hospital building, or help ensure continued presence of municipal public services in the traditional civic core to maintain a mix of people and uses downtown by helping the city through land grants. It's critical to offsetting compatibility issues created by Meridian's proposed use. Again, these are not necessary, but they are good steps to solution. Mr. Sid?
And I was asked to represent the city in a manner parallel to Mr. Arline for the authority. I think his assessment of Chapter 164 is pretty consistent with my experience. 164 can be handled informally, formally, can be handled essentially as a joint workshop of the board ultimately, or both boards. Essentially, the issues as they have been framed by the authority here, the existence of a non-conforming use claim, the potential claim that it would be continued by Meridian are very fact-specific sort of issues, and the sort of thing that could result in a fairly exhaustive legal assessment by one of the very capable local judges. But the point here is to see if the issues, not just of the nonconformity issue, but essentially compliance with public safety, compatibility, the traditional sort of police power issues that the mayor was discussing can be addressed in a resolution. And as far as we are concerned, and just as council, I think the direction is that we are here to listen and to see if we can reach some form of resolution, or if not, certainly try diligently to do so.
Thank you, Mr. Ansbacher.
Next item is assessment of conflict of parties. Authority is up. Mr. Arline?
Well, I think I did that previously. The specific conflict is whether the hospital property has legal non-conforming status or not. But as Mr. Ansbacher stated, this conflict group, the initial conflict group, has the authority to, address other issues that would resolve concerns that the mayor addressed, for example. But I think I laid out in my previous analysis what the assessment of the conflict is from the parties' standpoints. And I think I've let the authority executive director add anything to it if I've not stated the conflict as we see it.
These would be my comments. One is we're here in the spirit of cooperation, and hopefully we can come to a resolution. I want to make sure that everybody at the table understands that if there's not a resolution, it will be going to court. I think the public has a disdain for public entities suing one another. I certainly don't like it. I have been involved before, but it's not pleasant. And quite frankly, I think the courts don't like to see it. I think when the courts see two governments hammering out one another, they're not pleased either. So I very much hope that we can come to a resolution. I agree with the comments from the speakers in that we're here, or at least I think we're here, to resolve the issue about the zone. There are other issues. Mr. Mayor, I heard your comments. I've heard those comments many times. Just for the record, this is the 60th meeting since Meridian submitted a proposal. This is the 44th meeting that of those 60 meetings, Meridian has been discussed. So it's not as if this has not been a vetted subject. And it's also important to understand that the agreement between Lakeshore Hospital Authority and Meridian has already been approved. It's done. The only thing is it was done subject to a resolution of the ongoing dispute. So I don't know what's involved in reopening what's already been approved. That's certainly above my pay grade, but it needs to be stated for the record. Agreement's approved. We're no longer negotiating with Meridian. It was over. They've taken a vote. It was a unanimous vote. It was just approved with a subject to because of this ongoing issue. I understand the lots, but I see that as being a completely separate issue. I can certainly understand why the city would want those lots. It's not hard to understand. I think it's also important to understand that those lots have been requested by the county also. It was stated earlier that the property should go back to those that paid for it to begin with. I think it's hard to argue with that. I think it's probably correct. But there's more than one public entity interested in the lots. And I think what my board of trustees has requested is presentations from those entities. And they basically want to know, what are you going to do with the lots? When are you going to do it? How's it going to benefit the public? The very things that the city did when they initially received the lots, and of course they were then subject to the reverter. But they want to know what the plans are. They don't, my understanding is they simply don't want to convey property for the purpose of conveying it. There are a couple of other issues that come into play, mostly dealing with time. One, as you heard Mr. Arline earlier speak of the $50,000 a month. It's not, that is a real figure. It is very expensive to maintain that campus because they're keeping 24/7 security there. They're trying to at least maintain the grounds to a reasonable standard, so on and so forth. Water, sewer, gas, you get the picture. In addition to that, Meridian, who is to receive that property, a bill has been filed in appropriations to assist them with the necessary remodel and repairs. I can tell you that the legislature has told me that that bill will remain for consideration until it can't. So if there's a resolution is not reached before they can act on the bill will be dismissed. All in all, a lot of money is spent or lost while we decide what's appropriate there and how we can best resolve it. And again, I'm in great hopes. I mean, I consider all of you to be good, honorable people, like each and every one of you. I hope we can come to some resolution. I certainly understand the speakers. Anybody that's followed this will tell you that I, when they first proposed, was opposed to Meridian. I was. The reason I changed my mind is after we began to vet it. The very same facilities they're doing, which exist in Tallahassee and Orlando and Gainesville, and we pulled and we checked police records, 911 reports. We did those here also. They just did not show those concerns. Same types of activities, same types of medical services. I believe it was the one in Tallahassee that said, look, if we didn't ride by, we wouldn't even know it was there. Those were the kind of responses we got back. Then the economic side of it came into play. My understanding is there will be 200 and something people employed here. About 80 of those jobs are new jobs. So there is an economic component to it. At least in the early going, I know that some of my trustees went downtown and actually walked the street. They asked store owners and business owners. And I know we have a new administration in the city. I can assure you that the prior city administration was asked about their feelings. And we had 2 separate complete hearings. invited the public and anybody that wanted to come and speak, and we did. So I don't want somebody to think this has not been thought and vetted, because I could not agree with that. But having said all of that, we want to reach a resolution. We want to reach it as quick as possible. And we certainly want to avoid another step in this process, if at all possible. And hopefully, fix it.
Is it done?
I'd like to agree with Dale in that I think the actual lots and the zoning are two separate issues. I would agree with that. We would like very much to reach some type of agreement too. We think that's in the interest of all, best interest of all parties concerned. I'd like to point out too that this isn't a quid pro quo type situation. We're not saying we insist on getting the lots, we're asking for the lots. But the zoning issues are totally separate issues based on what we found in our interpretation of our zoning. That type of business requires an excessive amount of police services. So I would want to work out something to kind of address that for our police department so that we don't incur any undue cost in our budget on a yearly basis.
Just from a mayor's point of view, the budget in the cost basis always goes back to the folks who are paying that budget. Those are the residents here who would have to pay for the extra policing. Anything else?
As Mr. Artline said, I said it the first time.
Thank you.
So we would have open the discussion to the participants.
I have no further discussion.
Mr. Kenyon, would you like to hear anything from Meridian while we're here today?
We can, if that's okay with the board, maybe add some clarification.
Sure.
So, I'm David Evans, legal counsel for Meridian, and I've been working on this transaction for about 3 years, I think, from the beginning of it. And so the authority has been very diligent in negotiating with Meridian about the nature of the uses of this property, the restrictions on it, the requirements for it. Among other things, those requirements are 24/7 security on this property provided by Meridian. And I think you would find, your police department would find that Meridian would be happy to work cooperatively with the police department. And if it becomes necessary, there may be some sharing of expenses if there happen to arise undue expenses or anticipated expenses that relate to police activity on this property. But as Mr. Williams indicated, if you look at similar uses throughout the state, including at Meridian's facilities, they're well run. They're well run. It's not, they want to be good neighbors because that's good business for them too. And so if the concern is the uses to the properties put to and how we will secure it and how we will work with the city and the authority to make sure that people are treated, the citizens are treated properly and the people who come to Meridian for services are treated properly. I think you'll find that Meridian is highly motivated to do that. So are there any questions? I have with me Lauren Cohn, who is the president and CEO of Meridian, who's present with me today. If you have any questions for Ms. Cohn or interchange you'd like to involve?
Well, if I may, I have a question for you, sir. I'm concerned with how our police department is going to have to interact with this facility based on conversations that I had as early as this morning with the police chief. So if you could specifically talk about how you're going to address some of those concerns. And by the way, let me just stop there for a second. Maybe we can get the chief to come up and talk about some of his concerns.
Sure.
So that we'll start from there.
Yeah, okay, you want to begin with that or?
Yes, I want to begin with that. Thank you.
All right, sure.
Mr. Evans, maybe I can do it, you can do it, come back, go over what is required and what's prohibited.
Could you speak up? Whoever, I mean, one of us can do that.
I think
Happy to.
Afternoon. I'm Chief Butler, Police Department. Excuse me, Police Department. Let me start off with, I understand the need for the mental health facilities. There's obviously, police are well aware of the need. However, my issue is the location. When they say security, I'd like to know what they mean by that. Are we talking a security guard keeping an eye on the building? Or are we talking orderlies that will be inside helping with the patients? One of the reasons I'm asking that is quite often the police department is called the Meridian facility because the employees working there at night are often just nurses, not saying just, but as far as for asking my officers to hold down patients so that they can give them tranquilizers or an injection in order to calm them down. Now, the department policy is we don't do that. However, my officers are put in a bad spot because we get there in the middle of the night, we have a person out of control, they need to tranquilize them, they can't without us holding them down. My officers can't leave, because if we leave and they hurt somebody, that's not what we do. And in South Florida recently, you had a nurse that was almost beaten to death by a patient. So my question is, as far as security goes, are we talking 24/7 orderlies that will be there? Because the physical security of the building can be handled with an alarm system. I'm talking inside the building. The police department over the years responds over 300-400 times a year to the current facility. Right now, my understanding is there's about 10 counties that come here. Lake City comprises about 5% of the population, and the police department will be taking 100% of the responsibility, because if one of the counties comes and drops someone off, and an hour later they cause a disturbance, it's not that sheriff's office or police department from one of the 10 counties that are responding, it's the Lake City Police Department. And that puts a strain on our resources. If we're going to expand the amount of services offered, I'm only assuming that my call volume is going to increase by that percentage. So again, my concerns are call volume. Lake City Medical Center hires police for their emergency room 24/7 normally. And that's an emergency facility, not a Baker Act. We've been called to Meridian at night to do a Baker Act because there's nobody there that can sign off on it, and we've got to do a Baker Act ourselves. People go there, I understand the need, but my issue is the location. We've got security concerns. I've got parks, I've got residential areas, I've got other things around there. The city plans on adding a theater, amphitheater, and having events down there. That's all security. Somebody gets out of that facility, it's on the police department and the sheriff's department as a backup agency to take care of the problem. My concern again is the location and public safety.
Thank you, Chief. So I think the chief did a good job of highlighting the concerns that we've discussed. Maybe if you could address some of those for us.
Hi, thank you. I want to respond to some of the concerns generally and then speak specifically to the chief's concerns of the night. I want to acknowledge and address the concerns raised regarding the facility we intend to operate in the hospital building. I understand the anxieties that come with changes in the community, especially when it involves a facility that may be unfamiliar or different than what was previously in place. I know we've spoken to these concerns at meetings in the past and hosted a town hall, and as Dale indicated by giving us the numbers, quite a few. But I would like to again provide some information that may help alleviate the concerns and offer clarity on how facilities like ours can benefit communities. At the heart of our plan is a commitment to the well-being of individuals who face mental health challenges. Mental health is a critical aspect of public health, and our goal is to provide a compassionate, safe, supportive environment for those who need it most. The facility is designed not just to serve those in need, but also to integrate into the community in a way that fosters understanding, reduces stigma, and promotes overall well-being. I understand there are concerns about safety and potential impact on the neighborhood. It's important to clarify that mental health facilities like the ones we're proposing are not linked to higher crime rates or safety issues. Our staff are trained professionals, skilled in creating and maintaining a safe and supportive environment for both clients and the surrounding community. I also want to emphasize that placing a facility like ours in this neighborhood is part of a larger vision of making behavioral health care more accessible to those in need. I invite anyone to contact me to schedule a tour of our campus, as I believe what you will find is not what you are imagining. The individuals seeking care in our facilities are your neighbors, your friends, and your family, in need of compassion and support. We truly believe that accessible behavioral health care is essential for creating a safer, healthier community for all. And we're committed to making the facility a positive, supportive part of the neighborhood. And we welcome input as we all work together to make this a reality. So specifically to some of the concerns we've heard today related to the law enforcement involvement. One, our current facility does not have security, so we really, really appreciate the collaboration and the support that we've received from the chief and all of the officers. Second to that, I think by having security, we are not just talking about a building guard to stand outside. As the chief mentioned, that is something that could be done with an alarm system, but truly a security component that integrates into the care of the facility and is able to respond to some of the challenges we've heard today with the care we're providing. So that would be a difference in this. We're open to working together and talking more frequently and more deeply about some of the other solutions and other training opportunities and things for our staff to be able to respond independently or differently to some of the challenges that we see currently today. Another component would be, we've offered in the past, we've had some discussions about a co-responder model where one of our clinicians could ride along with a law enforcement officer and respond collaboratively to mental health related calls. That is something we're still open and happy to discuss and offer that as a potential additional resource for the law enforcement team. So that's kind of, I'm happy to answer any other questions or provide more information.
Okay, I don't have any additional questions. I would be a little uncomfortable with a law enforcement officer riding along with one of your people because of insurance and other issues, but I certainly appreciate the offer. And if there are other issues that we can work out to kind of address some of the concerns that the chief had, maybe you or the chief can speak after this meeting.
Absolutely.
But if he has the the authority to change the security issues there, that goes a long way towards satisfying our concerns. And I think that Dale and I can work out specifics and come to some type of reasonable conclusion on this.
Thank you.
Yeah, just for some information, I don't know who may or may not have a copy of the latest, greatest draft of the agreement for conveyance of real property to Meridian, but the trustees and negotiated this contract over the past 2.5, 3 years had a lot of the same concerns. And so we required certain conditions within the agreement. So it's on Exhibit B of our contract, purchaser, which is Meridian, shall commence operation of the following programs on the property: primary care or federally qualified health center program, inpatient crisis emergency program, crisis stabilization unit for children and adults, inpatient psychiatric beds with the numbers subject to funding. The following additional requirements shall apply with respect to the property. Purchaser shall operate a 24-hour, 7-day-per-week security program on the property. When they implement that program, it will also apply to triage and the screening of walk-in assessments for efficient access to care. They will use their best efforts to provide for coordinated discharge for individuals receiving care, to include transportation to home or other accommodations when needed, providing for discharge planners to assist in securing placement and step-down services in collaboration with caregivers and patient family members on transition plans. The purchaser shall not operate a state hospital defined as a mental health treatment facility owned and operated by the state of Florida. Purchaser shall not operate an outpatient medication-assisted treatment program on the property. Purchaser shall not relocate to or operate on the property the long-term adult residential treatment facility now located at Williams Manor. Purchaser shall not relocate to or operate on the property the traditional addictions outpatient counseling program currently housed at their campus on Michigan Avenue, and the purchaser shall not operate a youth residential treatment program on the property. And as to security, speaking with Meridian, some of their law enforcement calls, I don't know the percentage, but a fair percentage relate to the youth program, youth residential treatment. That will stay on Michigan Street and will not come to the hospital building itself. So that won't eliminate any additional calls maybe in the future that relate specifically to the youth program, but the youth program and the associated calls will not be from downtown.
That will certainly help. Thank you.
Maybe now would be a good time if you take about a 5-minute recess and we can each confer with our respective counsel and clients for a moment, and we'll come back. Call back to order. So what I have heard and would make the following suggestions is if Meridian is willing to meet with Chief Butler or whoever the city designates to go over and define language and duties and a description of the type of security that Meridian will provide at the hospital facility. Let Mr. Williams, Mr. Rosenthal work on further work on the zoning after the day issue, trying to iron that out. And then I was reminded that a special district is created to do a defined task. And Meridian, Lakeshore Hospital Authority was developed by the legislature, and the task is, the goal is, the mission is to provide for health care, both indigent and otherwise, countywide. And so that's why the authority has worked so hard with Meridian. You know, we have a building that otherwise will have limited uses. It's always been a hospital since it was there. And so to further the goals of the authority and to try to meet its mission, that's why we've worked about the last 3 years with Meridian to provide not a conventional hospital like Lake City Medical Center, but a mental health care hospital, for lack of a better way to phrase it, facility that will meet all of the things that we talked about earlier and will not do the things that we talked about earlier. And so we believe that's important for everybody to understand. In addition, in our workshops that we had over the last several years, it's been identified that in this area, other rural areas, that one of the primary health-related concerns and needs that are not being met is in the mental health area. And so that's why the authority has continued negotiating with Meridian and feel strongly that this is a plus for everyone. So that would be our suggestions moving forward from today's meeting.
Well, I actually think that's a good idea. I don't have any objections to that. As long as we can meet with the chief and resolve those issues that we talked about on security, I think Dale and I could probably handle the rest.
Yeah, just to follow up on that, and Dale brought this up earlier, to avoid litigation between two governmental entities, I think is important, but we definitely need to have these issues addressed, and I think that a good next step to avoid that from happening would be for the two managers to get together and hammer out a good proposal for the taxpayers and citizens of Lake City as well as the Lakeshore Hospital.
Specifically to address the issue that's paramount concern.
Another concern is brought up. That included, just to answer you, Mr. David, that included the zoning concerns, the policing concerns, and everything that's been brought up here at this meeting.
Anyone have an objection to adjournment? We'll stand adjourned then. Thank you.